Hi, I'm Dr. Vignesh from Elixify, which is located in Koturpuram. Today we are going to talk about PRP for hair loss. So regarding PRP, we need to know what exactly it is and to whom to use it for, and what will be the results and how many sessions will be available. These are the basic things which I'm going to concentrate about. So PRP is basically platelet rich plasma. So platelet rich plasma, it is derived from the patient's own blood for treatment, and today we are going to focus on PRP on hair loss. PRP can be done for both male and female patients, and the most common indications for PRP includes androgenetic alopecia, that is a male and female pattern hair loss, and number 2, it can be done for telogen effluvium and generalized hair loss. It can be done, and even for thinning of hair follicles, it can be used to thicken the hair follicles. So these are the most common indications of PRP. The PRP, how it is being done? First, we ask the patient, we undergo the basic routine blood investigations of all the patients before going for the procedure. Once the patient's report are absolutely normal, we can go forward with the procedure. Side effects in this treatment are going to be pretty less, and since the patient's own products are being used, so there is nothing artificial added in this particular procedure. Method how to do about this PRP is, first we ask the patient to come here. It is going to take around 45 minutes to 1 hour. Once the patient enters our clinic, we ask the patients to numb the area by using this numbing cream, or even for few people who are not able to tolerate the pain, we can give spray based numbing, or even for few people we can inject a numbing agent on the scalp. And number 2, we derive the patient's blood and centrifuge it. Once we centrifuge it, the patient's blood is going to be centrifuged, and it is going to get divided into 3 components. One, it is going to be platelet rich plasma, one it is going to be a platelet poor plasma, and one it is going to be the RBC. So we have to take only the top layer where the platelet rich plasma is present. That we have to take it in our normal insulin syringes, and we inject it onto the patient's scalp after cleansing the area thoroughly. And this is the procedure which is being followed for PRP, and it takes around 45 minutes for us to complete the procedure. So the patients who are on blood thinners are normally not eligible to go for this PRP. So during consultation, we ask the patient whether about the history of blood thinners, smoking, and alcohol and drug misuse, and if there are no contraindication, we can go for these procedures. And on blood investigation, the main thing which we have to see is whether the patient is having any bleeding disorders, any platelet dysfunction syndrome, acute and chronic infections, and any sepsis. So usually PRP is done for a period of 6 months. It's a 6-session procedure. Monthly once we undergo the treatment, and the patient will see visible results after the 3rd session, and after the 6th session they'll find a massive improvement. So do's and don'ts post procedure: the patient is asked not to wash their scalp for the next 24 hours, and to avoid excessive sweating, and to prevent too much of sternness and physical activity.